Okay, I would like to go ahead and start. Hello, I hope everyone can hear me. This is the webinar on representation and participatory processes as part of a series, a webinar series. This is the second out of the fourth, out of 4 webinars on the topic of social participation. And each webinar aims to present a chapter of the handbook in the handbook on social participation for UHC. Thank you all for coming. I realize that these are trying times at the moment, and all of our lives have been upended with the current viral crisis, and we hope that we can bring you a bit of distraction for an hour on a topic that we find very exciting, but at the same time it's quite complex, and it's an important topic in the field of health governance. So before I start the presentation, I will hand briefly over to my colleague Kira Koch, who will walk you through the process for this webinar, and then we'll go through a few slides, after which we'll do some question and answers. So I hand over to Kira.
Yes, thank you very much, and welcome to everybody from my side as well to this webinar. My name is Kira Koch. I'm part of the team here at WHO headquarters, and I will just use the first couple of minutes to walk you through our webinar procedure. This webinar today is hosted by WHO, the Health Systems Governance Collaborative, Health Systems Global, UHC 2030, the UHC 2030 Civil Society Engagement Mechanism, also called the CSEM, and the UHC Partnership. Today, our speaker is Dr. Deepa Rajan. She will give us a presentation on representation in participatory processes, and then we will have a Q&A session. Please note, for the Q&A session, we will not be using audio or video for this presentation. Kindly type all your questions in the chat box, and please make sure that the to section of the chat box says to all panelists and attendees. That's important so we can see all of your questions. So please, to all panelists and attendees. I will read out the question out loud later on, and Deepa will respond to the questions. I would like to just use this moment as well to provide you with the following information. We will be recording this webinar, and the webinar recording will be made available on the Health Systems Governance Collaborative website, and in a few seconds I will be sharing the link in the chat box as well for your information. We have 2 more webinars coming up. The next webinar is on legal frameworks for participation, which will take place on the 25th of March at 10 a.m. Central European Time. And the next webinar following afterwards is on capacities for mutually beneficial engagement, which will take place on the 1st of April at 4 p.m. Central European Time. And lastly, just a brief note for those of you who are not yet aware of it, we are having currently an ongoing UHC 2030 consultation on the handbook on social participation for universal health coverage. And we, of course, invite all of you here to fill out the survey. And once again, I will be providing you with the link in the chat box. Note that the survey is put up in English, but you are invited to respond in any language, and the consultation will be open until 10th of April 2020. So with that, I would like to hand over to Deepa again, and Deepa, please, you have the floor for the presentation. Thank you.
Great, thank you so much, Kira. So let's start on this exciting topic. As I said, it's representation, representativity. This is chapter 3 in the handbook on social participation for UHC. In the last webinar, which was the first of first webinar in this series, I gave you a very brief overview of the handbook project, and I won't do that again this time in the interest of time. However, if for those of you who are unfamiliar with the handbook on social participation for UHC, we did 3 webinars explaining the handbook and giving an overview of it a couple of weeks ago, and those recordings are available on the Governance Collaborative website, the Health Systems Governance Collaborative website. Otherwise, suffice it to say, this is a handbook that we've been working on for about 2 years now. We've done an analysis, an extensive analysis of both primary data from 9 countries and secondary data, the literature, and we are hoping to launch the book sometime this year, COVID-19 permitting. So on to the next slide. So one of the most oft-cited concerns of stakeholders in social participation efforts is the representativeness or the perceived representativeness of those who contribute to those participatory spaces. But on the other hand, I mean, so we see it quite a bit in the literature, in our primary data that we collected for the handbook. Stakeholders that we interviewed, key informants that we interviewed, repeatedly mentioned representativeness as a concern, as something that they doubted was being done well. But on the other hand, ironically or contradictorily, it's not explicitly reflected on in practice. So what we saw quite strongly is that organizers of participatory spaces did not reflect on the issue of representation in a structured way, and often it was not very transparent how representatives were selected, why they were selected, why others were not selected, and sometimes the selection was somewhat random in terms of people or organizations that were more easily available or accessible. But it's an important issue, and why? Because it's linked to legitimacy and credibility. And the notion being that those who are part of a participatory process should be representative of whom they're supposed to represent, which often is the public, but not always. And if they're seen as representative, then they're also seen as legitimate. And more importantly, if they are seen as legitimate, then the results of the participatory process are seen as legitimate, which then means that we have more policy uptake or a higher probability of policy uptake. But we see policymakers and organizers of participatory spaces clearly struggling with this issue, and some scholars propound the democratic ideal of a cross-section of the population to be consulted. This is embodying the so-called statistical representation, but practically speaking, we know that it's next to impossible for government health stakeholders to achieve statistical representation due to cost, feasibility, and scale. But more importantly, and that's what we'll examine in this presentation, statistical representation may not be the most pertinent or useful anyway in terms of health and in terms of the policy question at hand. Next slide. So this leads us to the conceptualization of representation, which we present in this chapter, which we felt is really more relevant for government-led participatory spaces for national health planning and policy making. So basically, on the one hand, what you need is obviously a well-reflected selection process. And what do we mean by well-reflected? We mean that there's participant diversity based on criteria that are adapted to the policy question. And this is where we do see weaknesses in participatory spaces, because the policy question in and of itself is often entirely unclear. And in order to be able to select your participants adequately, you need to know what you're selecting them for and define your criteria, which needs to be matched to a policy objective. So the first step is really to be crystal clear in terms of why you are conducting this participatory process, what are the objectives, what outcomes do you wish to achieve, and what is the policy, what is the real policy question at hand. And that helps you then match the participant group in all its diversity, and allows you to reflect adequately on your selection process. The second aspect, which is important, is the format and design of the participatory space, because once you have selected your participants, the format and design can help lend legitimacy and credibility to those whom you have selected to better represent a constituency or an issue. And we'll see how that is the case in the next couple of slides. So next slide, please. So first and foremost, I'd like to then reflect on the concept of representation a bit, because this is the framing that I think is really necessary to better understand the selection process on the one hand and the format and design on the other. So firstly, transparency and explicitness is really necessary with regard to participant selection. So the focus of this handbook is on government-led participatory spaces, where it is imperative to acknowledge that government has considerable power over how those spaces shape up, are used, and how far they actually give a voice to those who are commonly the target population of health policies. So acknowledging this reality implies that the starting point of any participatory space is imbalanced, unfortunately, in terms of influence and in terms of power. And one source of that power is clearly the legitimacy a participant may have or be perceived to have through the representativeness of a group or a community, because we know that government comes into these spaces with an inherent legitimacy because they have a government position. Experts, health professionals, they come in and they have legitimacy based on their expertise, knowledge, and sometimes standing in society. But lay participants and civil society often depend quite a bit on representation and representativeness of a group or a community, sometimes an idea or an issue as their primary source of legitimacy. And remember, legitimacy is equal to power and influence. And this is why this issue does need to be reflected on adequately. But unfortunately, what we do see is a certain vagueness in terms of the details on whom to consult and what they should be consulted for, people should be consulted for, and why. From a government perspective, one of the goals of a participatory space is really to understand so-called representative views. And indeed, the reasons that policymakers usually advance as a rationale for social participation efforts is the uniqueness of lay or civil society contributions, which are distinct from expert, professional, or government input. And so this is that representative uniqueness is really what is sought after in its diversity. But at the same time, the policy level pro-participation discourse, unfortunately, remains vague on whose views exactly should be solicited, what the implications this might have for those who would be implementing policies such as health stuff on the ground. The point here is that often the participation as a principle is seen in legal frameworks, it's seen in policies, it's slipped in to policy documents, and this is then given as a sort of orientation at a higher level. But when it comes to the how, the mid-level government cadres who actually have to implement it aren't exactly told what the actual objective is, why they should be consulting, whom they should be consulting and what for, etc., which makes it very difficult to really choose the right people. And again, that clarity and objective is really key, because if not, representatives often get selected arbitrarily, as I mentioned earlier. There's a lack of transparency in selection criteria. This is partly not always ill will, it's often just lack of capacity and the struggle that we see that policymakers have with the how of participation. And what happens then is that the more easily accessible, high capacity civil society end up participating more than others. And then we end up with further power asymmetry and a certain subgroup of the population taking up these participatory spaces just because they have the resources and the capacity. And the risk there is that the space then gets seen as unrepresentative, which is often used as a key reason to discredit participation-based results. So the risks are high, and this is why we really need to reflect adequately on this aspect of representation. Next slide. Now, what we see also in the literature very clearly, and also partly in some of our primary data, is that we definitely have a representation conundrum. The ordinary layperson really doesn't exist, but there is this pursuit of laity, as we say, or the term used in some literature. And that seems to be based on a sort of vague appeal of consulting the common man or common woman who can provide quote unquote ordinary insights, otherwise unavailable through other mechanisms. But let's face it, most people are not representative of a public in and of themselves, and no one person or group of people can really necessarily represent the full spectrum of the public. And some scholars even assert that it's quite unfair indeed to expect anyone to represent the public. So, and to make matters even more complicated, the mere act of participation itself makes you somehow less lay, because the more you participate, the more of a so-called expert you become or more professionalized, and the less lay you become. So the conundrum then continues when you examine which lay people actually participate, because we see experience clearly shows that there is a bias towards the elite in society, those who have time, those who have resources or a particular interest in the topic. And you could even argue that if you have a particular interest in the topic, then you might have a potential conflict of interest, and therefore you're not very lay. So the point here is that the boundaries in the end are actually quite fluid between the lay experiential expertise and professional, more technical expertise, and especially due to increasing professionalization of civil society. And so this is something to really keep in mind as we move forward and think through how we select representatives. Next slide. So what I would like to make the case for in the next few minutes is that in the health sector and for health, it is really qualitative representation that is most apt and most relevant. Here, what do I mean by that? So let's first talk about quantitative representation. So quantitative representation is what I mentioned earlier, statistical representation. So it's usually done through random sampling, and the aim is to mirror the population as it is with certain demographic characteristics. But firstly, as we said earlier, random sampling of the full population is administratively complex and it's costly. The other method often advanced as sort of truly representative is general election, an election process, but we know we cannot do that just for health, and that's also administratively complex and costly. But more importantly, there are inherent failings to both of these methods, which are particularly relevant in terms of health. So firstly, neither method actually guarantees that selected representatives mirror the population adequately in terms of those characteristics which are relevant for health and health systems performance. So we're talking about characteristics like gender, ethnicity, socioeconomic status, but also health needs, health system experience, minority group, etc. And elected representatives, on the other hand, are not always representative of all voices and are often contested even by minority views or groups who are often the very target of policies aiming to improve health outcomes. Next slide. Secondly, inclusivity and leaving no one behind is, or should be in any case, a key underlying principle of health policy making when we're talking about the context of universal health coverage. So in general, the literature and case studies that we looked at clearly insinuate that participant selection processes focusing on qualitative representativeness, that is, qualities that are relevant for the health policy question at hand, tend to be more successful in bringing in diverse voices. And when you're bringing in these varied and marginalized voices, you end up basically what you're doing is you're giving more weight to those voices in relation to majority views, thereby abandoning the basic principle of quantitative representation. And thirdly, many experts stress the distinction between, on the one hand, representing a population or population group, and on the other hand, bringing in the perspective of that group, either by being a member of it or through regular interaction and experience with it. And it's that experience and of that population group and that perspective that is the most germane in terms of population, community, and civil society input for health sector decision making, where policy options needs to address experiences of both individuals and needs of both individuals and populations. And indeed, in addition to a more representative population-wide view, credible and useful input during the participatory process has to include personal experiences with the health system, perspectives as health system users, caregivers, family members, as migrants, residents, citizens, etc. And this is expressed in the notion of experiential participation, where your encounters with the health domain is brought into these public consultations. And so what really works well is bringing in these efforts into a more mixed method approach. What we would like to see is qualitative representativeness through formal population group characteristics, combined with a genuine attempt to bring in these diverse views and experiences to enhance the legitimacy of those selected, as well as the process in and of itself. And finally, as a final point, I'd like to just say that, of course, quantitative representativeness is still useful in specific situations, but even better is when it's combined in a mixed method approach to also have a more focused method to target some groups that may not be speaking up. Next slide. So on the selection process, I'd like to address a couple of points. The first is that it does need careful attention and reflection, as mentioned earlier. And again, this is a topic, representativeness, selection process. It gets a lot of attention in the literature, and in our stakeholder interviews, there was a lot of mention of this. But it's striking how, despite all of that, there's really little reflection on this topic in the practical design of most participatory spaces. And again, the starting point in designing a participatory space needs to always be the clear objective and rationale in order to enable a selection process that matches that. And that's about the next point, which is understanding who the public is. And there are different publics within society, and we'll talk about that for a few minutes. Next slide. So the public in reality is a blend of different mini publics, and the boundaries can be a bit messy between the different groups, but it's important to have a solid understanding of the different groups in order to better select your participants, but keeping in mind that the boundaries really are blurry. So the first group is the lay people or lay public, often called the pure public, and these are those who are unfamiliar with the issue of discussion. And the idea here is to get a more generic, unbiased societal interest reflected in your discussions. And as pointed out earlier, of course, the ordinary person may not exist in reality and may even be difficult to motivate to participate precisely because he or she is unaffected. But the important point here is, why do we want this group? Because to have a more unbiased, unaffected view of the topic. And this would be, for an example, could be if you have a participatory space where the discussion is on diabetes, for example, then you would want, of course, people who do have diabetes or diabetics as well, but you might want to have some unbiased non-diabetics who have no diabetes in the immediate family and no interface with diabetes as a disease to get an unbiased, unaffected view. Now, keeping in mind that people are not unidimensional and there may be other dimensions that might still make them biased, but the point is to make that effort to get as far as possible that unbiased view. The next group is the affected public, which are sometimes called patients, service users, but it depends on the discussion topic, because the affected public could also be caregivers, family members, community members living in a certain location. These are basically people who are directly defined by the objective of the participatory process. So an example would be, if we have a discussion on air pollution's effect on health, then city dwellers would be more of an affected public vis-a-vis rural residents, for example. And here, the important point is that you want to get a sense of how the people who are affected by this topic, what is the reality of this issue at hand? And it's that view that you want. So it's an experiential knowledge which is sought, because the lay public as unaffected parties do not have that view. And the third group is the most heterogeneous and somewhat complicated. This is the partisan public. And this comprises of interest groups, advocates, non-governmental organization representing an issue, a topic, a population subgroup, community organization. And of course, the boundaries to an affected public are not always clear, because you could have a cluster of affected individuals organizing themselves, and they would be then both. But the main point here is to think about why you would want this group to be in your participatory space. And the aim might be the reality that without interest group buy-in, implementation might be difficult. It might mean that the reason might be that some communities might be hard to reach, so their voice can be more easily heard through a community-based organization intermediary. It might be because an NGO is respected within a certain health field and is involved in health service delivery, and so you need their input as well in health service planning, for example. So depending on the context, there's a myriad of reasons that can be given as a rationale to invite certain groups. Now, the caveat here, or the issue that you need to take into consideration or remember, is that the partisan public can be better funded or better organized than the other two publics, and may tend to crowd out the space with their dominant voice. And this might be acceptable or not. It really depends on your objectives, because if you want to gather views of, for example, of marginalized communities to improve health system responsiveness, you might want that voice and group to be predominant. And on the other hand, if we're talking about externally funded interest groups who might have vested interests which are particular to a very small group in society, you might need to think about how you can equalize their dominant voice. And by equalization, I mean, either you ensure that the numbers are small vis-a-vis the lay public or the affected public, or you have a separate process to go into communities to get the views of communities. It might mean not having your process take place in a capital city hotel where some voices might not feel comfortable speaking up. So there are different ways of doing it. The point is to think through the three different publics, is to think through where the power relations are between the different publics and how best to create that level playing field to have a feasible and fruitful discussion within your participatory space. Next slide. And 3 points that I'd like to also address in terms of the selection process. One is volunteering. So volunteers clearly are the backbone of participation. But unlike government cadres or academics who are usually paid for their time as working hours in contributing to a participatory space, civil society participation, lay people participation, more often than not involves volunteers who are taking their time and their resources out of a normal day job or their duties to participate. So there are consequences to this, to representativeness. Firstly, excessive volunteer reliance tends to exclude the poor, the working class, single parents, minority groups, basically those for whom the opportunity cost of participating is simply too high. And the other thing, again, is that relying on volunteers often gives undue space for professionalized civil society who can afford to participate and who have high capacities. So these are just things that need to be thought through, because sometimes it may not be possible to give funding for civil society, like in certain situations. Like for example, in Thailand, they have the wonderful health promotion fund, the Thai Health, which supports civil society to equalize some of these imbalances. Now, if that's not possible, there are other ways, at least through format and design and through the selection process to do that, but it needs to be explicitly thought through. And that leads me to the next point, which is the marginalized groups. And this is something I also said in the last webinar, and I will probably repeat it in the next couple of webinars as well, but additional effort is really needed always to reach out to marginalized groups. The primary and secondary data that we analyze for this handbook are super clear on that even the most sophisticated processes, even with all of the efforts and even good intentions, somehow marginalized groups do get left behind. And partly this is because government-led, more institutionalized structures have a strong tendency to reinforce existing power relations and societal hierarchies. And so an additional effort really is needed to counterbalance these tendencies. And as I mentioned earlier, some of those efforts means perhaps going into communities themselves, or in Tunisia, for example, they conducted separate homogeneous focus groups where for those groups like single women with children who felt more comfortable speaking amongst themselves and amongst equals. It might mean reducing opportunity costs for participants by going to their workplace and speaking to them there. So there are different ways of doing this. It really depends on context, but it needs to be thought through. The next point, again, I mentioned this earlier, is that combining techniques in the end really has the most advantages for these participatory spaces. And like in Tunisia, as I mentioned, they combined the focus groups for those who weren't speaking up, then they had public hearings to try to get to sort of the majority views. They also had a citizen juries to have somewhat more time for deliberation. The point is that the weaknesses of one method can overcome the strengths of the other, so combining techniques allows for a targeted and separate approach to selecting participants from each of the different publics as necessary. And this goes back to the notion that each of those publics have something distinct to add to a discussion. And I'm not saying you need all three of them, but that some, depending on your participatory process, depending on the actual policy objectives, you need to decide whom you want and why you want them. And next slide. And then just a few points on format and design. Again, the issue of transparency comes up here. Again, clearly formulating roles provides participants the legitimacy to be at the table and, more importantly, justify their contributions. And unfortunately, how participants are selected does remain a bit of a black box, but what transparency requires on the part of government or those who are organizing these spaces is an ability to communicate and to bring across information in audience adapted format. It means we're investing in making information available, and this is, unfortunately gets caught up in this struggle of how to set up the process. And it means you need capacity to speak to put highly technical information into less technical jargon. And so these are all capacity that does need to be built in a lot of ministries of health or government cadres. The next point is on preparing balanced, factual, more neutral information. And this comes up repeatedly also in the literature that the preparation of lay people, civil society, and community groups with this information is really a critical prerequisite for an effective process. And because people need to have a good understanding of the topic and make informed judgments based on the latest available evidence, and this then lends them more legitimacy to take on their representation role. This means, in some places, this means having access to experts, being able to listen to the spectrum of views and interpretation of the evidence. It's balancing the level of technical detail without overwhelming non-technical participants. So this, and preparing information in different formats, infographics, reports, briefs. This is something, again, I'll mention Thailand, they do it very well. The next issue of safe space. This is a somewhat intangible concept, I suppose, but it basically entails sort of the subtle impression that one's contribution is not valued, and a less subtle fear of repercussion for expressing views. And that feeling that contributions are not as valued, it comes from a lot of sources, but a lot of it is really just, the assumptions that are taken for granted when it comes from those who are seen as knowledgeable or experts or those who have influence, and the subtle dismissal of those contributions when it comes from elsewhere. And we saw this in a lot of our case study. For example, in Madagascar, where community health workers who were invited to a district health planning workshop together with their direct supervisors in charge of running the facility really didn't feel comfortable to speak up out of fear of backlash from those supervisors. Very briefly, the importance of competent facilitation. In the interest of time, I'll just say here that this is, having skilled facilitators can do quite a bit in making sure that some of the voices that don't speak up do speak up. There's a lot of format and design decisions that can be done by the facilitators, which help bring a more level playing field to the participatory space. Seating plans, ground rules with participants like Chatham House rules, agenda flow, specifically calling out certain people to give their views and give their opposing views, for example. This is an important point. And finally, I'd like to mention, parity of constituency groups, and especially in the context of formalized or institutionalized participatory decision mechanisms like health committees, hospital boards, etc. You often have seats that are reserved for civil society representatives or the lay public, but often there's too few. The percentage of seats that are reserved for these groups are quite low, and so you have concerns of tick the box exercises in that case when the number of people in the room from civil society is considerably lower than all of the others. But on the other hand, if you have the opposite, if it's too many civil society representatives and too few decision makers or policy makers or whatever, then you might have an insufficient link to decision making and policy making. So we don't have a magic number or ideal percentage split, but the point is that that needs to be thought through, especially in terms of the power imbalance and how voting happens in such spaces or how the decisions are taken in such spaces in order to balance that out. And the final point on participant rotation, I'd like to say that this is also key in order to avoid elite capture in terms of the power balance and the level playing field that a participatory space should always strive to achieve. It's important to ensure that there is some rotation of new faces coming in into these spaces. So the National Health Assembly in Thailand operates on the convention that no constituency which has been included in the past will be removed. So anyone who's in is in, and every year, depending on the resolution topics, new groups are always added. And so you have the advantage there that of the original mix of constituencies and representatives don't hold on to influence or power excessively, and they're forced to contend with new relevant actors. But at the same time, those who are motivated to participate and those who have institutional memory, their input is not lost. And so that's a nice balance that they've struck there. And many fixed civil society seats rotate after a certain term, like in the Health Council in Portugal, where they have 6 out of 30 seats for civil society, but it's not 6 fixed civil society organizations, depending on the topic and other factors that, after a certain, I think, 4-year term is up, then new faces do come in. And the point here, again, is elite capture, to avoid that and to avoid power or influence being then held by a small group of people. Then next slide is my final slide, and I won't spend too much time here because this is, we have a whole webinar on this on April 1st on capacities, but just a few thoughts maybe on the government side is that, government actors and really do struggle with this issue, and one of the key capacity issues here is to recognize the need to place an emphasis on this issue and to think it through, and the basis for that is a very clear idea of what the policy question is and what we want to get out of this participatory space. So thank you very much. Next slide. Thanks again, and we are open for questions.
Thank you very much, Deepa, for this presentation. I would just like to remind you that we will now start the question and answer session. Please write your questions into the chat box and make sure that in the two you have to all panelists and attendees. This will allow us all to be seeing your questions. We have already received a couple of questions from you today. Thank you very much. I will start, Deepa, with some of the clarification questions. The first question that came on clarification was from Nagui Salama, who was asking again to clarify what you meant by pure public, whether they are unaffected or unfamiliar with the policy question, especially here with regards to UHC. If unfamiliar with UHC, this makes more sense, but maybe you can elaborate a little bit more on that three dimension of the public that you have presented. Thank you.
Okay, thanks a lot. So UHC is, of course, a great example because it's a broad concept and it's something that really affects everyone in society. So in a way, you know, for UHC, if you'd want to think about what kind of, you know, what is your subject within UHC that you want to discuss in a participatory space. So if it's if you're, you know, the subject that you're discussing is very basic in the sense of we need, you know, are we going to, as a nation, move towards universal health coverage or not? If it's something at that very high level, then, you know, you might say we just need the pure public and we don't need to think too much about the affected public or the partisan public. But you might in your country have, for example, civil society organizations or academics who particularly look at UHC and study UHC, and they might be then under the partisan public. And under the affected public, you might want to target those who are facing challenges because there is no UHC. So in a context like, let's say, the US, you know, where a lot of people are not covered with health insurance and have barriers to access to health services, those might be the ones that you'd want to target. And again, you don't need to have all three publics at all in your discussions. It really just depends on the topic at hand. I would think that normally, you know, such a broad question such as do we want to move towards UHC or not would be then, which is so relevant to everyone, with even beyond it's beyond, in a way, beyond a health sector question, and it might be more of a political question, which then gets answered more at the political level through elections and through whom you elect. And in a participatory space within health, you would probably have a more refined issue that you want to discuss, where it is then becomes more easier to then define your different publics.
Thank you very much, Deepa. Another clarification question from Amanda Bender, which is going to relate to our target audience of the Handbook on Social Participation. It was a clarification question whether it is towards government or also towards other global health actors. And I'm seeing in the chat function box here actually quite a bit of a discussion between the context of global north versus global south of civil society, especially when it comes to civil society representation in participatory processes. So maybe you can reflect on this a little bit. Thank you.
Okay, yes, thanks for that question. I mean, the handbook, again, the concept of the handbook, whom we target, why we target them, and etc., are in the overview webinars whose recordings are online on the Governance Collaborative website if you want a lot of detail, but I'll of course answer the question now just to say that yes, our target public is definitely policymakers, mainly government. This was actually subject to a lot of discussion internally. We have an external advisory group accompanying the development of the handbook. It's called the Social Participation Technical Network. And and so we had a lot of discussion within that group, but also within another WHO internal group that also accompanies the development of this handbook. And the debate there was whether we target only mainly policymakers, government, or civil society as well. And the conclusion that we came after a lot of debate was that firstly, civil society has quite a bit of documentation already existing and guidance already existing for civil society by civil society, and the niche where there's really a gap is really targeting decision makers, and so this would be fulfilling that niche. And I can say that having gone through lots and lots of literature and the team having gone through loads of primary data as well, that is the case. It is really a niche where there is much more documentation for and by civil society on this topic. The second issue is that, as WHO, there is, it is questionable if it is our role to be, simply put, telling civil society what to do. I mean, our role is to tell member states what to do, or at least provide guidance and nudge member states in a certain direction to tell them what to do. And so those are two of the main reasons. There are several others, but yes, we do target policymakers, and mainly at national level where the decisions around UHC, the large decisions of the health sector, are made. that being said, in some countries, those decisions are indeed made at subnational levels, like in Nigeria or India, some very federal countries. So then it would be more for that level that is targeted. But the approach really is to see, you know, how are the voices of communities, population, civil society taken up ultimately in health policy making that steers the sector towards UHC.
Thank you very much, Deepa. Another question which has arrived us from Thomas Schwarz, and I'm just linking this again and using this opportunity for our consultation that is currently open on the UHC 2030 website. Please feel free to fill out the survey, which is still open until 10th of April. You will see some slide decks on the handbook chapters, and we ask you for your feedback on those key messages. The question from Thomas Deepa is related to our process of setting up this consultation process. How do we ensure that a representative group of civil society actors has been reached and has provided input, and that this input is not dominated by the most powerful ones, meaning of course those who are very vocal and have very strong ties to key stakeholders? Thank you.
Yes, thanks, Thomas. And I realize also that I should have addressed the global north and global south issue as well, but I'll do that in a minute. Yeah, so first, to start off with, so the Social Participation Technical Network, which is the group that guides the development of this handbook, is composed of about 40% civil society and community groups, and then the rest is about 30, more or less 30% academia, and then another 30% is member state representatives of government. And the civil society representation, we left that entirely to the civil society engagement mechanism of UHC 2030 to guide us on. We asked for, we wanted views from both the global north and the global south, but we also wanted not only large civil society organizations, but also more, as far as possible, smaller community groups. And what we came up with, I think, is fairly broad in its diversity. Whether it's good on representation is questionable. It's not something that because we put together our criteria, we had very clear criteria, but there were definitely gaps in some of the criterias because we were just unable to find, the right people who are willing and available to participate and to be a part of this. So I think we strove to achieve a good sense of representation in terms of certain criteria of diversity, geography, views, and funding. So we also wanted some smaller groups that may not be so well funded and so well known. I'm not sure we achieved it 100%, but we definitely did try to go in that direction. And then in terms of, and by the way, Thomas, we're happy to give you the list of, it's not a secret, the list of those involved in the social participation technical network. And it's actually on the UHC 2030 website, but we can send you the link, and happy to hear your thoughts on that as well. The issue of the global north and the global south, I mean, these are more global governance processes, which is not within the remit of the handbook. Again, we really focus on the national level and giving guidance to member states. One reason why we're doing the handbook, though, is because this all started in, in late 2018. A report came out by the WHO CSO Task Force on Civil Society Engagement with WHO, because Tedros is pushing to have WHO more actively engaged with civil society, which is a new way of working for us, as we're used to working more with member states. And one of the recommendations that came out of that was to do more in terms of giving guidance to member states to work with civil society and community groups. But that initiative is also looking at the global governance arena, and I'm sure Thomas and others probably know a lot more about what's going on within that space than I do. So it is being covered by another team actually within WHO.
Thank you very much, Deepa. Another question that has arrived us is from Hesam Gyarand. She is basically, or the person is basically elaborating as well that especially in the context of low and middle income countries, in order to have social participation for achieving UHC, there's also a need to develop concepts and to design structures and institutions for assuring the diversity of social and public engagement. Maybe you can reflect a little bit on that, which goes a bit in alignment on other factors with regards to an enabling environment that we are also reflecting on in our handbook chapter. Thank you.
Okay, sorry, Kira, can you just repeat the last part? I missed it.
I was just referring to some more reflections on what can be an enabling environment in order to have social participation in countries, especially in the context of low and middle income countries.
Okay, yes, an enabling environment. So our chapter 2 in the book is going to be on the enabling environment, and we have Katya on the line as well, who's currently spending a lot of time on that chapter every day, and who's authoring it. And so the issue of enabling environment in essence, and the way we are framing it, and based on our analysis of the literature and our case studies, is really, again, I come back to this idea of the level playing field and the inherent power imbalance and influence that is there. And an enabling environment is really about those who do have more power, which is in this case mainly government, but also others, making a visible effort to iron out those imbalances. And by doing so, you are creating more of a safe space and trust in the process for those who are on the disadvantaged end of that power imbalance to then actually speak up and have a voice in these participatory spaces. Now, this is definitely not a given in a lot of countries, and legal frameworks can be helpful in bringing that in to some extent, depending on how detailed the legal framework is in specifying details of a participatory space, which then inherently help with that power imbalance. But otherwise, it really, it goes back to how far these efforts are made, whether they're mandated or not, in order to bring that playing field to a more equal level and enable everyone who is there to then take on their representative role and to give their best in a way, and to work collectively towards a feasible policy option. And again, this is not a given at all, but there definitely are, and it's not necessarily about democracy or not democracy, because we do see in countries that are not strictly democratic that there is quite a bit of participation at local levels, or even regional and even at national level. And it's about these efforts that are being made and the level, and that is linked to the level of freedom that you have to make those efforts, and to the level of freedom that you have to then take these voices into account and change what you might be doing. And that what we see is it's linked to a democratic ideal, but it's not always linked to a strict democratic government.
Thank you, Deepa. Another question which has arrived us, and there has been a little bit couple of back and forth here in the chat box, is on marginalized population and how we can actually ensure, or what needs to be done in order to ensure that marginalized population groups are also participating. As we all very well know, this is a key challenge, and it needs to be reflected in order to have a true, inclusive and participatory process.
Yes, thanks. So this is really, it is a challenge. There are so many reasons why marginalized groups really, unfortunately, do not participate. And a lot of it is about the enabling environment. It's about the visible efforts to level the playing field. It's about creating that safe space. And the important thing really is that at all given points in time during the design of a participatory space, during the actual participatory process, it's very important that the simple question is constantly asked: who is not at the table? And by doing that little analysis at every given point in time, then you get a sense of whom you need to reach out to in a much more targeted manner. And some of those ways I mentioned in the presentation, such as going to communities, having them speak amongst themselves in homogeneous groups, having a facilitator from that community, going to, because the opportunity cost is quite high for these groups often, so going to their workplace, to their homes if need be. And sometimes it might just be through the local district, or through local representatives, or the local chiefs, depending on the context. So focus groups are often helpful there. Sometimes it might be then through just a general survey, because in a survey, what we see inside, there's a little bit of literature around the fact that surveys, because they're anonymous, and and even online sometimes, that some people might be more willing to then give a frank view of things. So it's a very context dependent, but there are ways to do it. But the point really is to think that through and see how to do it. And sometimes, and if you're struggling with how to do it, how best to do it, also given limited funds, sometimes it might just help to find a representative from that group and ask, and to work out how to do so with a representative of that group.
Thank you very much, Deepa. I'm seeing that we have already completed our 1 hour of the webinar. If it's okay, I would still go ahead, and we will maybe run over 5 minutes, if that is okay with you. In order to use that time, there was another question on monitoring and tracking feedback from participants, if there has been any lessons to be shared. And similar to that, on the power imbalance and level playing field, which need experts' coordination and advice, how is that managed?
Sorry, Kira, but you're breaking up a little bit on me. Say that again.
Sorry again. The question was on monitoring and tracking feedback from participants, if there has been any lessons to share, and here as well, in order to maybe link it to sustaining engagement of participants over time in participatory processes.
Yeah, thank you. Thank you for that question. Yeah, indeed. Our one of the chapters, as you know, is on sustaining participatory engagement over time, and one of the issues that indeed we did look at, and that did come up in our review, was the issue of feedback to participants. And many participants that we interviewed within the remit of this handbook felt that sometimes they would be participating, and their views and their opinions and went into a sort of black hole, and they didn't really know what happened out of it afterwards, or because sometimes the link to their input and any sort of policy or action might be very much further down the line, and that link might not be so obvious. So that feedback loop is important. And in terms of motivation of participants, is hugely important. Again, in Thailand, where we conducted in-depth interviews, and this is a place where they've been doing the National Health Assembly for 10 years formally, and 20 years under another format. We did speak to people who, and organizations, civil society organizations, participants who have been participating for a decade, and much of some of them, had a bit of waning enthusiasm, because they felt that that their participation wasn't really going anywhere to anything concrete in a fast enough way, because they weren't seeing that feedback. And fortunately, the organizers of the National Health Assembly had the brilliant idea a few years ago to set up a resolution follow-up committee. So every resolution that goes through the National Health Assembly then is subject to follow-up through this follow-up committee to see how far it is being implemented, and if not, to activate the various channels to do so. And that has helped to increase motivation of participants. And so this feedback loop is really important. That being said, we unfortunately couldn't find studies looking specifically at that issues, or many studies weren't designed that way, to look at how far feedback in and of itself was the key motivating factor. But we did find that it was one of the important areas that people mentioned as key to ensure that people continue to participate.
Thank you so much, Deepa. Maybe a last question, which very much links to what you have just mentioned, and this goes quite in alignment on maybe we talked quite a lot on what policymakers and governments can do, but in a lot of cases it's about inventing those spaces as well for lay people or community organizations, civil society organizations, in order to enter into a policy dialogue. Do you have any reflections on that, on how and what civil society lay populations can do in order to foster this collaboration with governments in this respect?
So yeah, so this concept of invited versus invented spaces is something that crops up in the literature quite a bit. Invited spaces being those that are invited by government, invented that those that are sort of claimed more by populations and civil society. And what we see firstly is that you need both. You know, in invited spaces, you have the advantage of a much more direct policy link and influence on policies, but often to get those invited spaces, you need the invented spaces to sort of claim them and to encourage them. And the invented spaces are quite important to encourage then the invited spaces to be created. And what we hear quite a bit from policymakers in terms of what civil society can do, it's about is to come to the table with the objective of finding a solution, finding a joint solution. And I think what a lot of policymakers have problems with or have difficulty and is sort of the more advocacy oriented quote unquote angry civil society or people, you know, to confront with. And the reason why they struggle with that is often those towards whom this anger is vented are mid-level government cadres who don't have that influence to really do anything about it. And so they feel a bit powerless in that situation. And second is that things end up being very heated. The discussions become very heated, and often you don't get to sort of a feasible for policy solution. That being said, I do realize, and I think we all realize, that sometimes there is a lot of anger that's pent up. There is a lot of emotions and views that need to be expressed, and they may not always be positive, and that's what these spaces are also for. And especially when creating such spaces, what we see, for example, in Tunisia in the post-revolutionary context, as you can imagine, it was very heated at the beginning. There was not much feasible or rational discussion being had, but that initial venting that was necessary to then overcome and get to a space where you could start discussing with each other in a more rational way. And this is what policymakers are able to more feel that is more accessible to them, and feel that where they feel that there is a real will to collaborate. And part of that is about, you know, capacity for civil society to translate some of these, some of the injustices that they are seeing and experiencing with the health system or in communities, to translate that into something that is that is able to be discussed in a way that's relevant for policies. And that means partnering with evidence generators, for example, and working with intermediaries that might help, or other organizations, in building alliances who might have some of those capacities if you yourself don't have it. And it also requires, however, capacities on the side of government, because government also needs to learn how to understand what people are saying if it's not in a technical jargon. They need to understand the value of that and how that can be translated into policy. So it's really on all sides. There's real need for capacities to come together and understand each other's language. And building that capacity, besides sort of more formal capacity building programs, is all about having that space to practice, to have that space to come together. It might be difficult, it might be heated at the beginning, like in the Tunisia example, but many other examples. And sometimes you might have the feeling that it's not going anywhere. But the point is to have that space to build that mutual understanding, and at least, at the very least, even if you disagree with the other person, to have a certain degree of understanding for a different point of view and a certain respect for that view.
Thank you so much, Deepa. We have come to the end of our webinar, and I would like to use the opportunity to thank everybody online to be with us today. Please be aware that, as mentioned before, we will be sharing the recordings and the slides on the Health Systems Governance Collaborative website. We will also make sure that we go through the chat box again. I know that there have been some questions which we were not able to answer due to our 1 hour time slot, but we will make sure that those will also be answered and going to your way. Maybe as a last reminder, we have a next webinar coming up next week, next Wednesday, the 25th of March from 10 a.m. Central European time. And of course, we would very much like you to participate again in this webinar. Until next Wednesday, I wish you a very nice evening, afternoon, or morning, depending where you are connecting in. And please stay safe. Thank you very much and goodbye.
Thank you. Goodbye.